Hello, Women's Advantage Men's Optimal Health community. I'm Sarah Pizzey, one of our pelvic health physical therapists. And today I'm here to talk with you about how we talk about pain science and how we use different relaxation and meditation techniques to help our patients with pelvic pain. So what I'm going to start with is share my screen. Okay, and I suppose it won't let me go full screen, but that's okay. So this today's Facebook Live is going to be what is currently in the research and what we do in our practice to help with chronic pain science and how we explain that to our patients and what tools that we use to help with getting muscles and the nervous system to respond to our treatment interventions the most effectively. So we're going to start out our conversation by talking about the central nervous system, because that is our superhighway of how our body sends different information, such as pain signals, to our consciousness, our awareness of what our body is actually perceiving. So the central nervous system refers to both the brain and the spinal cord, and it's the system that carries information from our body to our brain, which then makes sense of the information and then sends the appropriate response to that pain. So how does this relate to physical therapy? Well, a lot of what we see in physical therapy is people have tension in their muscles. And a lot of that can be driven by our central nervous system in response to pain, stress, anxiety. And when we start talking about this part of the central nervous system, what we're talking about is the autonomic nervous system. The autonomic nervous system has two different roles, or two different subcategories. You have our sympathetic nervous system, which is our fight or flight nervous system, and then we also have our parasympathetic nervous system, which is our rest and digest nervous system. So it's our body having to decide what state that we currently need to be in. Is everything fine? We're safe. We should be most of the time in that parasympathetic state where our body will divert its attention, including its blood flow, its nervous system attention, to our gut and to help rest and digest. But if you are under some kind of stress or anxiety or pain, then our body shifts into the sympathetic nervous system, which then tries to problem solve. So what needs to happen? Do I need to run away from something? Do I need to be prepared to fight for something? I often will use kind of a primitive analogy of the saber-toothed tiger, that when we evolved, we had predators that we were having to worry about, or enemies that we might have need to decide to run away from or to fight. So our body needs to be ready to solve these problems in an instant. And in that case, your nervous system needs to focus more on the muscles that are going to help you fight or flight. And so what happens is when you get a repeated threat over and over again, then our nervous system starts regulated for that threat, and your body needs to becomes more aware of the possibility of this threat occurring again. So our body tends to fall into these patterns of wanting to stay in that side of our nervous system, in that fight or flight type of a nervous system. And that can result in muscle tension, because our muscles are what are going to help us fight this fight. And so things start to tension up. And if muscles are chronically tight, then they can even become shortened because they're not moving through their motion as they usually should. Therapist, where are we too tight? Where are we maybe too weak? what's being over dominated, and what is our central nervous system's response to some triggers that come on. Somebody that experiences chronic pain, their body perceives that pain as a threat, and it becomes so sensitized that even what might normally be a pain that you wouldn't really think too much about, maybe you kind of bump into the kitchen counter corner as you're walking by, and yeah, you might kind of rub it off and say, oh, that's not fun, but you go along with your day. Things like that send your nervous system into more of this fight or flight state, and your body becomes more anxious and more defensive in the presence of even smaller pains. And so we do a lot of work with our patients in understanding their pain, that it doesn't always mean that it's an emergency that needs to be attended to at that moment, and that it's our sensory system just warning us of something. And so we're going to talk a little bit about how we use relaxation techniques and different types of interventions to help us relax our muscles and to relax our nervous system. So the first one, yoga, that's a popular one that a lot of people practice as a form of exercise and meditation. What's nice about yoga is it is incorporating strength, flexibility, body awareness. It incorporates breathing. It's using meditation. You're really focusing on the activity at hand. Yoga instructors are very good at helping to describe what you should be feeling and what your focus should be, so that you're activating the right muscles, you're holding the correct posture, and things like that. So several of us in our clinic will use different yoga techniques as part of our treatment, different yoga postures, whether it's more restorative positions or even more traditional positions. I know one stretch that we give quite often for pelvic pain, because it also helps to stretch and relax the pelvic floor, for example, is happy baby pose, where you're lying on your back, you're grabbing your feet with your hands. It's a great hip opener. And then when I have patients do it, I often will have them breathe at the same time. So they're really working on relaxing their pelvic floor and relaxing their body into this stretching pose. Next is biofeedback. So we use different types of biofeedback. Biofeedback is a term given to a way for you to sense how your body is responding or performing during an intervention. So one of the most common forms of biofeedback we use in pelvic physical therapy is surface EMG, which we place an electrode over the pelvic floor muscles, and both the therapist and the patient watches a computer screen that has a graph showing us what state your pelvic floor muscle is in excitability. So if it's active, if you're asked to contract, that graph is going to go up. If you're asked to relax, then that graph should go down. It not always the case. Sometimes we have people whose pelvic floor muscles are overactive and they're working a little more than they need to be. So sometimes we need to work on getting that graph to come down before we even work on it contracting. But we also definitely use it for our strengthening practices as well. So it's a great way for people to see something they normally can't see. When you're doing physical therapy for somebody's arm, you can watch what they're doing with their arm. They can watch their performance. They can see how well they're doing. But your pelvic floor muscles, you can't see them. And not everybody has the same sensation of feeling when they're contracted and relaxed. So biofeedback gives us that window into what those muscles can be doing. So it can be an effective form of treatment for several of our patients. But other forms of biofeedback that you might not realize include things like heart rate monitors. So we're going to be talking in a little more detail later about heart rate variability, which I'll explain. But basically, watching your performance and how things like breathing and meditation can change your heart rate. It can lower your heart rate. It can change your respiration rate. So there are devices out there that will help you to read what your performance is. Even on a lot of cell phones, smartphones these days, there's a little monitor on the back where you can put your finger on it and it will read your heart rate, or I think some of them even read O2 sats. And so these sensors are becoming a little more popular, and that can be a way for you. It's a form of biofeedback, I should say, for you to understand how well your body's reacting to the intervention that you're trying to apply. So that can be using things like breathing techniques, which we're going to talk about next, diaphragmatic breathing. So it's a really powerful tool for our patients because one is diaphragmatic breathing, which means that you're using your diaphragm to primarily breathe. You're not using a lot of the accessory muscles. So if you're doing diaphragmatic breathing, you're trying to focus on getting your belly to expand and fall as you're breathing, and not letting too much motion come from your chest. That indicates that your diaphragm is doing most of the work to bring in your air and then let go to release your air. So with diaphragmatic breathing, it is, I like to call it our direct link to our nervous system and to our autonomic nervous system, that fight or flight or rest and digest state. When you start to control your breathing rate, you're able to communicate to your nervous system your perception of how safe you feel and what you want, how you want it to respond. If you breathe nice and slow and controlled, you're telling your body, we're safe, we're okay. We don't need to worry about the threat that might be occurring concurrently at the same time, such as maybe a chronic pain. Doing the breathing is going to help our body decide to shift its focus more into that rest and digest state instead of that fight or flight state. So diaphragmatic breathing can be really powerful for that. It's also great because it helps our pelvic floor, that our diaphragm and our pelvic floor, they work parallel. And although you might not know it, as you're breathing, your pelvic floor should be moving along with your diaphragm. So if you're working on your breathing, then your pelvic floor is going to follow that. And that's a really nice way for us to help teach the pelvic floor to relax when we want it to, and to lengthen. And we use that quite a bit in our treatments. There's different types of breathing activities that you can do in terms of how you're breathing. Are you timing your breath in and out? It's thought that a breath rate of 5 to 6 breaths a minute can be very great at stimulating this more parasympathetic response in our bodies. And so working on breathing in for 5 seconds and out for 5 seconds. That's called 1-to-1 ratio breathing. There's breathing where you can breathe in for 4 seconds, breathe out for 8 seconds, and that's called 1-to-2 ratio breathing. There's also box breathing where you do a breath in for 5 seconds, hold for 5 seconds, out for 5 seconds, and hold for 5 seconds. So these are different strategies that we can use to help really access that part of our nervous system and improve our pelvic floor response. Guided imagery is when we're trying to imagine a certain state for our a certain state or environment to help elicit the kind of response in our body that you might experience in this. For example, you're sitting on a tropical beach in the warm sand. You feel the sand between your toes. You smell the smell of the salt water or the taste of salt water on your lips. You see the waves lopping on the sand. And so you're using these kind of images to help elicit what you may be feeling in this scenario. Or if I'm trying to teach somebody to relax their pelvic floor, I might talk about, imagine your pelvic floor is just melting into the ball underneath you if you're sitting on an exercise ball, something like that. You're trying to elicit a response based on what you can imagine and a state that you can put yourself in. Meditation is it can use things like imagery, but it's really learning to be in the here and now, and to focus your brain and your thoughts on something in particular. And it can range from breathing, it can range from spiritual and religious meditations. We will often recommend things like now apps that you can get for your phone to help encourage different types of meditation. So you may have heard things like Headspace, Calm, Insight Timer. There are even YouTube videos that lead you through guided meditations and mindfulness activities. So we will often have our patients look into things like that to help them with performing these kind of relaxation techniques at home, because it's one thing for us to do it in the clinic where we may see you for 45 minutes once or twice a week, but you have how many other hours that you're away from us. So these are very helpful tools to help carry over some of the things that you're learning in PT into everyday life. So next up, we're going to start talking about the research that we looked into. So today's Facebook Live is primarily on what does the research say. So we looked into something called heart rate variability, and it's a form of biofeedback using heart rate variability. So when we have a heart rate, where that's how frequent our heart is beating, say, per minute. And that can vary depending on what our nervous system state is, our state of arousal, our activity level. And we find that in people with chronic pain or anxiety, stress, poor sleep, their heart rates tend to be higher. And our heart rates are not necessarily equal. Like every beat does not come exactly equal, or the same interval between. That our heart rate can vary, and it should vary depending on our state. Even as we're breathing, as we're taking a breath in and out, our heart rate fluctuates slightly. And so that's what the variability is, your heart rate's ability to change depending on what's occurring inside and outside of your body. And when you are in more of that sympathetically driven state, or that fight or flight state, that variability decreases, and as your heart rate might increase, but the variability in your heart rate decreases. But if you're more in this rest and digest parasympathetic state, your heart rate can vary quite a bit, and that's considered a good thing, and it can reflect how well your body is trying to focus on resting and digesting and relaxing. So there are tools that you can use, whether it's a monitor you wear on your finger. I've seen rings that can monitor what your heart rate's doing. There's ones that you can get for your earlobe. And a lot of these devices connect to a smartphone or a tablet, and it gives you your performance about how well you are doing and in improving your heart rate. It's usually involving something like a breathing activity. So studies are now starting to be performed to see how can we use these devices and these types of relaxation activities to battle things like chronic pain and stress and anxiety. So the study, we looked at 3 different studies. The one we're going to talk about is regarding postpartum anxiety disorders, but we also looked at its effect on people with chronic back pain and even with fibromyalgia. And research is really showing that heart rate variability biofeedback, where you're doing an activity while it's monitoring your heart rate and you can watch your performance, can be helpful at decreasing perception of pain and decreasing anxiety. So in the research study that we looked at regarding the postpartum anxiety, is they gave mamas who've just had a baby. It was 4 days after they had their child, a HRV biofeedback machine, and they trained them to do this activity every day where they're breathing at a rate of 5 to 6 breaths per minute. And they did this daily. If they were in the intervention group, they did this daily. And then they also followed some mamas who were just given standard protocol and were not given this particular biofeedback unit. And the moms that were in the intervention group were asked to do this every single day. And then 1 month postpartum, both the intervention group and the control group were brought back in, and their heart rate variability was measured again, as well as they were asked to fill out something called the Edinburgh postnatal depression scale, which is really common if you've had a baby. A lot of doctors' offices will give it to you as a screening tool for postpartum depression, but this measure was given to patients right afterwards, and to or in the for the 1 month postpartum, to see if the group that was in the intervention group and they were doing the biofeedback daily, if they had a lower incidence of or a lower score on the Edinburgh postnatal depression scale, which it did. It did end up showing that they did have a lower score, as well as that, or I should say, specifically in the areas of anxiety, difficulty sleeping, and sad and miserable feelings. That 1 month postpartum, that the women that were routinely doing this type of biofeedback had better outcomes a month out. So it's showing that these types of things are promising, and that it might be more widely used in practices like physical therapy that deal with people that have anxiety or have chronic pain. I'm hearing good things about its use with endometriosis. So stay tuned for hearing more about this form of relaxation technique and pain science coming in to help treat, or at least help people manage their pain. These things are not going to necessarily cure your pain, but it really can help to manage things. So that is where I'm going to wrap up. Please, if anybody has any questions after watching this video, you can place it on the Facebook page or on YouTube. Put questions in the comment section, and we will be going through at the end of the month and trying to answer any questions that anybody has come up with. Also, stay tuned for our guest speaker webinar for February. On February 24th at 2 p.m., our therapist Linda is going to be interviewing pain management specialist Dr. Leah Rispoli. So we're excited about that. Please look at, if you don't receive our emails about it, take a look at our Facebook page so you can find out how to sign up for that, because I think it's going to be a really interesting talk, and how a pain management specialist takes an approach on something like pelvic pain. So we look forward to seeing you guys back. Please ask questions if you have any questions about what I talked about today, and enjoy your day. Take care.